Next, finishing with neurological disorders, the study design requires you to know about Parkinson's disease. What do you need to know about it? It is a movement and mood disorder that is usually seen in the elderly populations. It occurs due to the death of neurons in a structure in the brain called the substantia nigra. It is a condition that also progresses with time and happens when the nerve cells in the brain that are usually located in the substantia nigra, but as we're saying, they've died. They cannot produce sufficient levels of dopamine. So the level of dopamine is reduced. And this chemical is naturally made in your brain and it is needed for control of movement, smooth control of muscles and movement, voluntary movement, namely. So, as the amount of dopamine over time, the progression of this disease decreases, so does the smoothness and control of all of our voluntary movements. And there are four key motor symptoms of Parkinson's disease that you're assessed on: tremors, the shake, and I want to say that none. It's not that these are present in all people. The symptoms that they experience and the severity are different. Tremors is the most common, though. Almost everyone with Parkinson's at some stage will develop some sort of tremor. Muscle rigidity, stiffness in the movement, slowness of movement, which is also called bradykinesia, really slow movements, and postural instability, balances issues, difficulty standing up, increased likelihood of falls, so on and so on. Um, but most people with Parkinson's are diagnosed around 65, but 1 in 10 get an early diagnosis before the age of 45 as well. You need to know about the symptoms of Parkinson's. So we said tremor was the shaking at rest. It's usually one-sided at first and it spreads to the other side. The muscle stiffness is also called rigidity. It can also cause pain, but it also contributes to the postural issues that are another one of those key symptoms. Obviously, having all of these physical movement symptoms makes it difficult to take care of daily activities such as getting dressed, cooking. We have those changes to posture, bad posture, chances of falling. And early symptoms are difficult to notice. So it's usually when these motor symptoms appear that someone may go with concern to see their doctor and find out what's going on. You also need to know about the non-motor symptoms of Parkinson's disease and be able to give some examples. These include problems with speech. Obviously, movement is involved in speech as well. A loss of sense of smell, sweating, fatigue, difficulty sleeping, confusion, panic attacks, mental health issues such as depression, restlessness, localized muscle pain, um, slowed speech in particular, swallowing issues, potential difficulty swallowing, um, and being tired all the time. Fatigue, not really by resting, it's cold. Those are some key ones. Um, so lastly, about Parkinson's disease, they've used animal studies to investigate Parkinson's disease in ways that ethically wouldn't be allowed using humans because we used to know so little about it, and it's still not a disease someone can get better from. We only have medication that sort of slows it down, like dopamine substitutes like levodopa that you'll read about in your textbooks. But for example, for these animal studies, animals might be induced with Parkinson's disease, so decrease their levels of dopamine, and then treated with experimental medications they use on humans to try to determine how effective it is. This is quite cruel, but because it is such a common disease in many, many elderly people, this is how they've tested drugs in the past on animals, and neuroimaging techniques. So, to measure the progression of the disease and find that it is Parkinson's, and track that progression course and what causes Parkinson's, they've used neuroimaging techniques such as the PET scans or MRI scans that you'll also learn about to try to find out how much brain structure and function have changed over time. Neuroimaging techniques can also measure the level of brain activity of someone with Parkinson's versus someone that doesn't have Parkinson's. So give us really accurate information about it. So obviously Parkinson's is an example of a progressive and fatal brain disease. People do die from Parkinson's over time. But the study design wants you to look at CTE, chronic traumatic encephalopathy, as an example of research into brain disease. Now, CTE is a progressive brain condition that is thought to be caused by repeated concussions hitting our head, um, and potentially getting concussions as well. So hard hits to the head and concussions repeatedly. The symptoms of it is it eventually leads to dementia, which is that lack of ability to retain memories, remember things. It also leads to short-term memory loss, not being able to remember things that have just happened, asking the same question again that you just asked, things like that. Mood changes, anxiety and depression, and difficulties in decision making. So it leads to personality changes as well. Now, this makes sense when you think about it. Repeated concussions means repeated damage to different parts of the brain. Okay. So the brain isn't able to recover, and we get dementia like symptoms, issues with memory, issues with personality, complete changes in those things. So there's currently no test to actually diagnose CTE. Encephalopathy is literally brain infection, brain injury. So there is inflammation involved in this, but it's not able to be definitively diagnosed. The diagnosis is based on past participation in contact sports and presenting symptoms. So it's the set of symptoms and whether that person engages in sports, because that's the common way to get repeated concussions, such as playing football and hitting the ball with the head over and over. That's a common way it can happen. But MRI and CT scans, again, can identify those changes. And however, not all brains clearly show CTE. It may be difficult to find. Then it is definitively diagnosed after the individual dies, so post-mortem, because then we can conduct an autopsy and examine the brain in detail. There are only supportive treatments for this and temporary medications, just like Parkinson's disease cannot be cured. There's no long-term treatment. So this is your second type of progressive and fatal brain disease.